Magandang umaga po. Ako po si Carmela Arellano at tumatawag po ako galing sa St. Luke's Hospital. Maaari ko po bang kausapin si Miss Rosemary Lagrada?
Yes, ma'am. This is Rosemary Legrada speaking.
Tumatawag po ako upang mangalap ng additional information regarding po sa recent lab test po ninyo. So, bago po yun, maaari ko po bang kumpirmahin ang iyong birthday at address?
So, pinanganak po ako on December 26, 2001 and at Barangay Tumarbong Rojas, Palawan.
So, ang yung ibinigay po na impormasyon ay pinapangako ko po na mananatiling confidential at ang mga tao lamang po na kinakailangan ng access nito ang magkakaroon. Ang information po na inibigay ninyo ay makakatulong upang maiwasan ang pag-spread ng COVID-19. Ma'am, I would like to confirm or maaari ko po bang malaman kung may nakapagsabi o napag-alaman nyo na po ang resulta ng iyong lab test?
No, ma'am. No, ma'am, not yet.
So, I would like to inform you, ma'am, that the result of your SARS-CoV-2 test from July 28, 2022 came back positive. So, I would like now to follow up, ma'am, some questions and diagnosis regarding to your COVID-19. I will also go to the next step in taking care of yourself and preventing infection to others. So, I will ask numbers of questions to get the information that is needed to determine on how we can help you. Is that okay with you, ma'am?
Yes, ma'am.
Thank you. So, we will get started. Please feel free to stop me anytime with my questions or if you have any questions in mind. So, I will start the questions now. So, I would like to tell you first about how COVID-19 is spread. So, it is spread through close contacts with the person who is infected with the virus that causes COVID-19. So, sometimes it is spread for short times through air when an infected person cough or sneeze. So, have you had any symptoms of COVID-19? If yes, I will go to the list of symptoms so you can tell me if you had it recently.
So, ma'am, I experienced dry coughs and difficulty of breathing.
So, ma'am, I will now ask what date each symptom started.
So, it was started 3 days ago.
So, ma'am, may I ask if you have any health care provider?
So, I have Peel Health Insurance that covers COVID-19.
So, where was your test done and what date it was done?
Okay, at Luke's Hospital and on July 28, 2022.
So, may I ask, ma'am, if do you have any other current medical conditions?
No, ma'am.
So, now, ma'am, I will go to the complete systematic review po ng mga kasama nyo sa household, sa trabaho, or sa mga inatinan nyo pong social gatherings beginning in 48 hours. So, maaari nyo po bang ibigay sa amin ang date, location, at duration po together with their names and phone numbers? So, I want to assure you that we will not release your names to your contacts and you are not required to personally notify them of their potential exposure. It is very important to let your household contact know what they should stay at home and quarantine for 14 days from the date that their last exposures to you.
So, I live with my family and other relatives.
Okay, ma'am. So, please, let us start po sa mga taong nakatira kasama nyo. So, please tell me their names of the people you've been living with beginning for 48 hours before you start feeling sick po. So, please provide me their names po.
So, I live with my auntie and uncle, namely Florinda Gajardo and Rafael Gajardo, and together with their children, Iris Gajardo, Flor Gajardo, and their granddaughter and grandson, which is Aldrich Gajardo, Algin Gajardo, Alfred Gajardo, and Jubel Gajardo.
So now, ma'am, let's turn our attention to where you were 48 hours before you became sick. So I want to assure you that we will not release your names to your contact and you were not required to personally notify them. So did you work outside or do you meet any friends outside within 48 hours?
So, ma'am, I don't have any work, but I meet some of my friends, namely Justin Padul, Cecil Segovia, Carmela Arellano, and that's all.
So for the finale, ma'am, may I ask if someone visit your home within 48 hours of becoming sick, of you becoming sick?
No, ma'am, I don't have any visitors at home.
In addition, ma'am, I would like to ask if did you go grocery shopping, run any errands, meet up with any friends, stop at coffee shop, gas station, bank, childcare? Did you go to a church, a healthcare facilities?
No, ma'am.
So, ma'am, can you also provide us that or tell us what you did 2 days before the symptoms on the morning, in the afternoon, and evening, then 1 day before the symptoms onset on morning, afternoon, and evening?
So, okay, ma'am, in the morning, I stay at home with my family, and then in the afternoon, I meet some of my friends, and then do some stuffs and drinking coffee. The same routine goes on.
Since you are positive of COVID-19, it is very important that you stay at home and distance yourself from others so that you don't pass or infect to anyone else. So you will be required to isolate yourself. That means stay at home until are fever free for 3 days and 10 days after your symptoms first appeared. You will also be required to monitor your symptoms for all the days you are in isolation. Being in isolation is legal requirement and your local health department will issue a legal isolation order to you. Do you agree to allow us to send isolation order by emails by accepting the orders? This way, you are allowing health officials to spread more focusing on slowing spreading of COVID-19 virus.
Yes, ma'am.
So now, ma'am, I will going to discuss how you should self-isolate to protect others in your household from exposure. So first, you should stay at home in one room away from others as much as possible. Next, use separate bathrooms if possible. Stay at least 6 feet from others and wear face masks if you are around others. Sleep in a private room with door closed. Have a food prepared by others and delivered to your doors. Use disposable eating utensils if possible. Next, bag any garbage and leave it outside your doors for pickup. It can be put in regular trash bin. Next, have some else taking care of your pet if you have pets. Next is you may need to have someone else to do your laundry. So they need to wear gloves if handling the laundry of sick person. If possible, do not shake dirty laundry. Launder items as appropriate in accordance with the manufacturer's instructions. So clean the disinfectants cloth hampers according to guidelines above for surface. Next and last is prohibit visitors who do not have essential needs to be in the home. So ma'am, let me clarify. You are also allowed to walk outside of your house on your property. But you should remain 6 feet away from others and wear face masks. You should not leave your property, home, or apartment except to get medical care. So do not visit any public areas. So ma'am, can you please describe me the place where you are currently living?
So I live with the in the neighborhood and with my family and other relatives.
So ma'am, are you able to isolate yourself at home?
Yes, ma'am.
So what other persons and pets currently are you living with?
Ay, anong aside? We don't have pets, ma'am.
So, is there a way you can live in separate part of your home during this time?
Yes, ma'am.
Is there a door that separates this part of the house from others?
Yes, ma'am, I have.
Is where you live safe from any intruders, ma'am?
Yes, ma'am.
Is Are there shared common areas in the house or apartment?
Yes, ma'am, we shared common living rooms.
So, do you need to use the same kitchen as other? Can foods be brought to you?
Yes po.
Please let me know if you have any concerns about being able to isolate. It is important that we work together to prevent the spread of illness. How would you feel about these guidelines? Do you anticipate any challenge in these following guidelines?
Yes, ma'am.
So, as I said, you need to be monitored during the time that you will be in isolation. We will be calling you daily for the next 14 days and will ask about how you are doing, your temperature, any symptoms, and any needs. Do you have any working thermometer?
Yes, ma'am.
So, as we discussed, you will need to isolate for at least 10 days from when you started to feel sick. So, you may able to identify a friend, neighbor, or family member who can assist you. But if not, please let me know.
So I think ma'am, my cousins and my aunts can assist me.
So, ma'am, please let me know if you feel unsafe in home now or in any point during your home isolation. So, being infected with COVID-19, being in isolation for many days, and all those goes with it is very trying experience. We can also arrange you to talk with the trained professionals if you are feeling anxious and depressed.
That would be that would be great, ma'am.
So I am glad that you feel well enough to be home at this time. However, I want to be sure we have a plan in case you start to feel worse and think you need to see a doctor. If you feel that you need to immediate emergency medical care, do not hesitate to call 0956 or a local emergency number. In addition of telling the operator about your emergency, you should tell operator that you have diagnosis with COVID-19. Some signs of an emergency includes trouble in breathing, persistent pain or pressure in the chest, new confusions, inability to wake or stay awake, bluish lips or face, bad injuries, and other emergency not related to COVID-19. So, ma'am, may I ask in addition, do you have a healthcare provider and do you know how or you are able to get in touch with him or her? Do you have any healthcare insurance?
Yes, ma'am.
So, thank you very much for your time. The information you've shared is very helpful in keeping us safe and protecting those others from the spreading of COVID-19.